ICT in healthcare, in the healthcare. Let me explain you definitely what is a healthcare and what is ICT. In healthcare does not, but in commonly we understand कि ICT in healthcare means ICT computerization of hospital. It is not that exactly. Healthcare is defined as per WHO definition is a preventive, curative, rehabilitative, all the component. So we come to preventive is basically prevention of diseases, and curative is basically primary, secondary, and tertiary curative like dispensary, middle level hospitals, and tertiary care means referral hospitals. Rehabilitation is basically you would talk about the physiotherapy. Training is another aspect is also training and uh, training and human resource development. Let me say, if you see to me, it is broadly divided two groups, at a micro level and a macro level. In the micro level, suppose example of one hospital, say Apollo Hospital in Delhi, is only one hospital. Do a computerization of that hospital, we say it is an HIS, Hospital Information System of Apollo Hospital or Gangaram Hospital. But if you think of the government sector, we have got multiple hospitals, chain of hospital. Let's say I can talk about MCD, we have got 6 hospitals. If I think of HIS in MCD means HIS of 6 hospital and connecting all the 6. Second, coming to macro level, I mean we have got in the connecting all the dispensary located in Delhi is 1,438 square kilometer. There are dispensaries around 52 dispensary. There are 115 health center, health maternity centers, 23 health center, 32 maternity homes, 11 TB clinics. You know, if you ask me the question, what is the macro level? If I connect all these things, it is a macro level implementation of what software. Second part is, now I have explained to what is an healthcare. Now let's come to what is the role of ICT. Why do we need computerization at this stage? I say it is very plain is computerization. Why do we need the help of a computer in managing the healthcare industry? Very first thing is that what are the problem with the existing manual one, you have to understand. Very first thing, database. We create a database in writing a register which is never somebody has written. Class 3 employee sitting in the counter, write everybody registration, what is your name, father's name, address. It's a very, very important question, and that register, that data gone in the register, and it's been kept in a record room. We cannot create a link. Number 2 coming. Suppose the one data used by everybody. Say example, in case of a pregnant woman coming to a maternity home, they write name of the patient, husband name, घर का address क्या है, what is the age, what are the second thing, when you go for immunization of the child, again the same data is collected. Again they go for registration of birth and the same data is collected. So this data is very difficult to link because of manual system. Fourth thing, suppose today I am working, I am attending a doctor in Badarpur, and suppose I go to Narela. Nobody can see what treatment was given to me at Badarpur. When I go to Narela, the doctor cannot check my previous history if I don't have the papers preserved. So these are the typical issue of database. Second thing, the expectation of public is gone very high. Long queues in the hospital, long queues in dispensaries, people's irritation, and people are expecting by this government that the doctor should come their doorstep and treat them. So the expectation of public is gone in manifold. Then the budgeting. If you see the budgeting past year in the government sector, the budgeting, the adequate budget is not available. Number 2, 3 is manpower. जो manpower हमारा आज and today is available with the any dispensary or the hospital, it was definitely in the some 20 years back planning. So the increasing the patient is increasing in manifold, and the staff is inadequate. So the patient and the staff, the patient and the doctor ratio is not been never been taken into consideration while did this planning 20 years back or 30 years back. Fourth thing is that the legislations. There's so many legislations coming. I can only quote one legislation is COPRA, this Consumer Protection Act, where the doctor has to pay penalty for any default. So here the doctor, we can save a doctor from the records. So we call it if you capture all the record through a electronic record, then everything can be downloaded or it can be preserved for many years to be for the to help you to protecting your own staff also. The fourth thing is now is the diseases emerging and re-emerging of communicable diseases. So I give example in dengue. In dengue is occurring in Delhi after every year 1 year gap. There are in Delhi also you have got cholera diseases as are existing. So we need a disease surveillance, and with existing staff strength connecting all the hospitals, it is very difficult. I give you another example of registration of birth and death. We have got only sanction state 34 and vacancy and the existing staff is 19. Imagine 4 lakh 30 4 lakh nearly 4 lakh 50,000 registration of birth and death per year. How many people will be satisfied with this existing staff strength? Only through ICT based we resolve the issue. With the help of computerization connecting 600 hospitals, we have resolved the issue. So these are the reasons of mine where ICT plays a major role not only in the individual hospitals but also in the macro level connecting all the hospitals, chain of all the units of a healthcare. Started the ICT development in way back in 2002. We started working how to go about it, bring computerization, and we evaluated by going to the field, understanding what is the difficulties people are facing. The first project we did is the registration of birth and death. The waiting time was more than 1 month, where people come and apply for a certificate and they get a certificate after 1 month. Today, the people who apply for a certificate and get a certificate same day. This is the first project we did it, and we have proven the benefit of it. Subsequently, we have done a project of HIS, Hospital Information System. We did it for 6 hospitals. At the hospital, the bed strength varying from 1155 to 100 bed, and we connected to create an electronic patient folder. Why this thing? Because the concept here we given is different. Let me explain you one thing. We don't have an R&D, and we involve our own staff in we do a brainstorming and take a decision on consensus, and those are the concept which has been used for developing the software. One of the most important software in HIS, register a patient once in lifetime. Given unique HID, he can go to any 6 hospital or he can visit the hospital repeatedly. All the records have been preserved. Every transaction, every lab report, every X-ray report has been kept. Getting encouraged from this too, we did a project on immunization. We utilize, I told you that database utilization is one of the most important factor of ICT in health sector. We took the data from RBD, registration of birth and death, and created immunization record so that the patient, whenever the birth is registered, the immunization record is automatically generated. Second thing, on the basis of date of birth, the date of taking the immunization is also been populated. If it date of birth is, then when the first dose of polio or the second dose of polio, everything comes through the system. So that is very helpful to the citizen. Then third thing, we try to do a mother and child information system. In the mother and child information system, we registered all the pregnant women. We registered all the pregnancy, delivery. Then we got to the post delivery. Then got family planning, the toddlers, and subsequently all the programs of the government of India like Janani Suraksha. Everything is implemented through this, and it's programmed this way, and we generate the NRHM report automatically. Then we did one procedure for the school. We have got 1800 schools and 9 lakh school children. So every 9 lakh children, we have got the primary objective: take a health card of the children, see that the health card, check them repeatedly on a regular interval, and maintain it. So we have got a school health services information system. Then we got a medical care. We have got so many dispensaries, polyclinics, health centers, maternity centers, so many things. To see that connectivity, everything, we develop a system called a medical care, and we have connected it to the HIS. It's a part of HIS, but in a smaller form. Look at the HIS, that we can broadly divide it into 3 categories. Dispensary, where there is only 1 doctor or 2 doctors. Number 2, we come to the polyclinics. There are number of specialties more, and the doctors are more. It is upgraded It's a daycare. It is upgraded dispensary. Then you come to primary health center. There are 12 beds. Then you come to colony hospital. There are 100 beds. Then you go to hospitals. So linking everything to the hospital in order to create a referral system with develop medical care. Then we have done a lot of other things like biomedical waste management. We have done software. We are doing it, and there is a medical certificate. These are the things for the hospital one. But the training modules for the hospital is CME and training module for the hospitals. In addition to that thing, we have done couple of more things like disease surveillance, vector-borne, waterborne. Vector-borne is basically dengue, malaria, chikungunya, and waterborne is cholera, gastroenteritis, typhoid. For this thing, we have developed a software implemented all across Delhi in order to find out which are the preventive, how can you say the benefit I'll tell you later, but let me see how we are connecting the hospitals. We are connecting data at source, and that data is helping through here to take a remedial measures. But in addition to that thing, you got a huge manpower, so you have done a payroll for the staff, we have got a promotion for the staff, transfer, posting, vehicle management, house allotment, everything we have completely. That's totally is called a health package. Key factor for success for any computerization if it is being used by the end users. Let me explain to you. In a hospital, the end user is the staff nurse, the physiotherapist, the dietitians, or it is a radiologist, or it is a storekeeper. So if you go to any of my hospital, you see the staff nurse using one finger is entering the data for the discharge certificate, or it is intending medicine from the store, or it is sending the samples to the lab. So these are the key factor. How you achieved it? That's the main question. We have not recruited a single person only for computerization. We have trained and retrained and trained repeatedly to our own staff, and we have done this thing with the organization change management or OCM. We have set up n number of training centers all across Delhi. We in particular all the 6 hospitals, and now in the civic center we have set up training center. The people are given training in basics and the training in the module. The basic means we train them for few hours. It's like around 8 to 15 hours the people are trained. We don't focus more on the basics. But subsequently, once the training in the basics is been shifted to the environment, a training environment where they have been trained on the application using the modules, and they are given a user manual, and subsequently we do a hand holding. Hand holding means that we have set up 10-20 computers in one room. Everybody goes and do a training, hand holding and training in the computer, and once that's over, they go back and work. When they work back, we have set up a help desk, and the number is given to everybody. Any problem, any given point of time, they immediately talk to my help desk and get a guidance. So over a period of, I started HIS in 2005. Over a period of 2011, I don't have to continue it. We only train the people who are coming on transfer or new recruiting. So that is the only thing we are focusing. In all the modules, I give an example of mother and child. We have trained 850, I repeat 850 ANM or PHN and doctors to the computer basics. Subsequently, they have been trained in the computer using the modules, and they have started using it. In case of tuberculosis, when I implement TB, CIS TB, in case of that thing, every group, like say registration module, the MRC have been trained. In case of lab module, the lab people have been trained. In case of X-ray, the X-ray people have been trained, and they have started using the module. But little bit handholding is required, and they have to little bit of patting, handholding, and subsequently you have to give a user manual. They should read, and supported by a help desk. This is, I think, has brought a change to MCD. This is my personal experience. Whatever you do is basically is only for the patient. We are not doing anything. It's for the staff. For to getting a credit that you have done a computerization. Yeah, we have. It's not a status symbol. Thing is that our aim is how the what benefit will be given to the citizen. So we at place we can say citizen, at place we can say the patient. The very first thing is that like so I broadly now divided into two groups, now in the public health as well as the medical care. In case of public health, when the transaction time is grossly reduced. The transaction time means when I come to take a certificate, the very first thing I give you example of registration of birth and death, where the people who stand in the queues, they get a certificate same day. How it has been happened? We impaneled 600 hospitals of Delhi. Every hospital is given a user ID password. They start sending the information through the computerization to my database server, where the registration number has been given. The moment the citizen reaches my citizen service center, he just apply for giving his name, date of birth. They download and print a certificate and give it to them. This is the benefit they get. You ask any citizen of Delhi how they're getting the benefit. Number two, tracking and monitoring is very important factor in so many areas. It's mostly in the tuberculosis. Delhi very prone for the TB. And how it is happening? We are following a system called DOTS, direct observatory treatment, where we give the medicine to take in front of a paramedical staff. What is the problem here? Once so TB is a low socioeconomic status, it affects the low socioeconomic strata people. So in that condition, what actually happen when I am a laborer? If I get a symptomatic relief, I stop taking medicine, I go to my daily wage, I have to earn my livelihood. So it's very difficult to track the defaulter at the earliest. Number two, suppose I am located in one place, I am shifting my house because of my transfer or something else. So naturally, the transferring my information, my treatment information, my disease information to another location is very difficult. Here in ICT, what actually happening? Let me give you the example of TB. I am taking today my operator, my whatever this TV worker, he sees through the computer who are the people supposed to come today and they have not come. Immediately we send a person to his house. Where is he? Why is he not taken the medicine? That is the way socially we will definitely find out the treatment of the patient. We treat the patient and how it is helping the society. Spreading of the disease has been curtailed, it's been reduced. Number two. Suppose there's a pregnant woman is in one corner of Delhi and he shifts to the other corner of Delhi. The doctor can log in, see the detailed data of the patient, of the pregnant mother, and they can see, okay, this is the treatment, the tetanus has been given, this is the first trimester finding, the second trimester finding. It's called an electronic patient folder. It is very, very useful. Third thing is that in a tracking monitoring, another thing I can add you one thing, like in other diseases, like a school children is in one place. We are making a health card. 9 lakh school children and 9 lakh school cards. He goes to another shifts to another place. Naturally, they can download. I can see the child's the detail, or is a malnourished, or is it what medicine has been given. Is the factor is that I can put a question here. Is ill health is the factor for school dropouts? Yeah, the teacher can find it out. What is the health status of a child? The future of our nation. And fourth thing is that coming to the public health side, we have connected so many hospitals. It's called we called it is a Sentinel Hospital, 35 Hospital of Delhi, where the moment they diagnose a patient of dengue, immediately they look into the system. That straight reaches to the public health officer. This person at this address is suffering from dengue. So the public health officer, without waiting for the confirmation, they do a remedial measure of spraying around 50-60 houses around that thing, cutting down the focal point, cutting down the spread of dengue mosquito outside the area, thereby cutting down the spread of dengue or epidemic in locality. These are the way the people are getting benefit out of it. The fourth thing is that suppose you are having a health card, you are You are having a health card, UHAT card. If you go to anywhere you like, I mean to say, you can go to a different area like Ayurvedic, Unani, or homeopathic, or anything of your choice. You go and show your card. They fit the number. They automatically your demographic profile and the past treatment given to you by MCD is been it's been downloaded and been checked. So the patient does not have to worry about other thing. Is a state matter, that has been taken care by the state government. So naturally, what is actually happening today, we are not. One thing major issue we are facing is the standardization. Every government is making some software in some area, either through JNN, RUM, or by aid by the international agencies. Everybody is trying to improve, put ICT in the national level. But point is that the biggest problem is the standardization. If I have done something, other cannot use that. So standardization is a major issue in one of the major issue in this IT implementation at the national level. Number two is that the rural area people has to be benefited. The connectivity is one of the major issue to the rural area. In the urban area like Delhi, Bombay, Chennai, it is okay. It's not a big issue. Issue will be if you think of the Gram Panchayat, the rural area, and we should think how this thing can be taken to the rural area through connectivity, hardware, infrastructure, other infrastructure, training, and manpower development. The government should focus on these points. So honestly speaking, we don't have a very big team. We engaged different partners, from the industry, like for Bharta, Tech Mahindra is one of the major partners here for the e-governance process through which we are delivering most of the thing. But HIS it was Wipro with us. From some other thing, other companies also involved, and we outsource the thing, get it done. But thing is that applications are being run by the employee of this organization, and they have been thoroughly trained, retrained, or reoriented, and we have done maximum our best to make them use the computer, and they use this application, and they see that the benefit must be given to the citizen.
So
Number
that
two, another benefit which I missed is basically what benefit is is given to the employee. They become very now the if you see the places, if you shut down this computation for 1 minute, everybody will revolt. No, we cannot work in the paper. I can do n number of instances where I get telephone call के साथ computer down है, 1 घंटा हो गया काम. Alternately, you do the work in manual. No sir, we cannot do manual work. Number two, that means the people are accepting slowly and steadily this thing. Second thing, the administrator. I sitting here, if I know how many people have come, patient has come, how many doctors have seen, how many patients, what are the type of operations are being carried out in my OT, what is the OT timing, scheduling, what are the inventory in my store, what are the inventory I am going to use it. Like I brought a IDM software called IDMS, Integrated Drug Management System, in which I can see the drug label at each dispensary, how many, what is the stock, what is the consumption pattern, how many, what are the economic ordering quantity, everything I can see the thing. So managing, it is a very big asset for the managers and the administrators in the government sector, and it will be very helpful for everybody who are using it.